I'd like to see people move it to a more sort of a higher professional standard, that knowing that when you're exposed to trauma and knowing when your limbic system engages, there's a sort of processing phase, that you take that as your next step, that kind of aspiring to, like, if you're a professional and you're exposed to trauma, this is just part of maintaining your system, just like maintaining your physical fitness, or just like maintaining your weapon or your vehicle or whatever. Your body is a system that needs maintenance, and true professionals will actually maintain it all the time.
The military lifestyle is all-encompassing.
It's difficult, but rewarding.
Dynamic. Very, very dynamic.
Unpredictable.
You are in the Canadian Armed Forces or a family member connected to the military. You know the lifestyle can be a challenge.
Military lifestyle is always changing.
In this podcast, we explore the world of deployments, postings, and transitions. This is the military lifestyle. Here's your host, John Shaboon.
Trauma, post-traumatic stress disorder. Those words might spark a reaction in you. Imagine being able to change the culture around trauma and PTSD. Imagine when people seek treatment, that it's treated the same way as recovering from any other injury. Dr. Tim Black is an associate professor of counseling psychology at the University of Victoria. He's been working with the Canadian military and veteran community for over 20 years and has delivered programs to help people deal with trauma. So I'm welcoming Dr. Tim Black from the University of Victoria. We're going to be talking about trauma and resilience. Thank you for coming.
Yeah, you're welcome. Thanks for having me. It's nice to see a real person.
Yes, definitely. So tell me, what things cause trauma in a military setting?
Yeah, I think they cause trauma, whether you're in a military setting or a civilian setting. What causes it, I'm glad you asked that to start off, because a lot of what I do in my work is trying to help people understand how people get traumatized and what is trauma. So maybe a bit of just sort of background, like around, a lot of people think that when you're exposed to a traumatic event that you get traumatized. And it's not necessarily true. And of course, in a military setting, people hear these stories all the time. It's like, well, I was there. I'm not traumatized. So then oftentimes they feel like it must be some character flaw or something about the person or something, because, if you have 8 people who are all in the area and all saw the bad things, say something happened in a particular environment, and only one person ends up with PTSD. And that's sort of based on some of the myths of what I see, a lot of myths around trauma. And first is like, what is a traumatic event? And traumatic events are not just things that are kind of mildly upsetting. Mildly upsetting or even highly disturbing doesn't necessarily mean they're a traumatic event. Really what it boils down to, you can't be traumatized if you haven't been exposed to a traumatic event, but you can certainly have a lot of negative outcomes from being exposed to things that aren't trauma. There isn't a clear dividing line between something that's super upsetting and trauma, except in terms of when we treat trauma, we're looking for certain things. So for example, a car crash where somebody, is badly injured would constitute a traumatic event. Not getting into the program that you wanted to at university never will be. So you can't be traumatized by not getting into the program you wanted to get into. That's just simply not, at least in terms of how I define it, that most of the trauma practitioners I work with. We follow, for the most part, the DSM-5 definition. For your listeners, the Diagnostic and Statistical Manual of Mental Disorders. I have a lot of stuff to say about that manual in general, but I like the definition of trauma for certain reasons, and some of it I think is problematic. So basically, you become traumatized if certain things happen, but it has to follow exposure to a traumatic event. And of course, in the military setting, there's a lot of exposure to traumatic events.
With people that you've worked with, were there like a few things that kind of stood out, like experiences that I'm sure people want to put them in like little categories, right? Of like, this happens, then potentially it could lead to a traumatic experience. And the war in Afghanistan was obviously huge.
Yeah, well, the reason why I like the definition, it's not perfect, is it really outlines, and I don't have it in front of me and I won't try to go off my memory of it, but basically it's something that is sort of a threat to life or limb, or even threatened physical violence or sexual assault, that kind of stuff. Even threatening violence can constitute a potentially traumatic event. And again, what makes the event traumatic has to do with the event itself, but that doesn't guarantee you're going to be traumatized. So you can be exposed to a traumatic event like a violent assault and not end up traumatized. And I think that's the thing that I'm really trying to help people understand, is that there's a process to, quote, becoming traumatized, of which being exposed to a traumatic event is the first domino that has to fall. But that's not the only one that has to fall, because there's things that happen after that that will lead to someone actually being traumatized, say, by an event.
What are the effects of a traumatic injury?
That's where we start to get into talking about, like, what does it mean when you start to think about someone being traumatized? Most of this is about teaching people in sort of what I would call trauma literacy, and, using all the background that we have in our teachings. There's experts all over the world that are doing this incredible work, is to understand when you have that traumatic event, if you have what's called a limbic response to that, so say like that car crash or whatever the exposure is, and your limbic brain, what we call, those of us in the trauma field, I didn't come up with it, the lizard brain, this part of our brain that responds to threat. Basically, we all have a part of our brain that responds to threat. It's the thing that makes us nervous. Anytime we feel threatened, it activates our bodies. And in extreme cases, it can activate us to do that fight, flight, freeze, or flop response, or those kinds of things. If you have a limbic response, you can do all sorts of things, but the four main ones that we teach are fight, flight, freeze, or flop, as a full, what we call limbic or lizard brain response. So of course, the fight one is pretty clear. You fight. The flight is pretty clear. You take off, try to run away. The freeze one, people don't understand as much, but it's when if you ever seen somebody who gets really scared and they just go stiff, like someone's just frozen them. And then the flop response, which is one we just sort of learned about in the last little while, is that like someone's knees will just buckle and they'll just lose their ability to stand. And those are sort of adaptive responses. If those things happen and you end up traumatized, we can talk about in terms of how does that all happen without making it too complicated. Really, what I see, the quintessence of trauma is the past being re-experienced in the moment. And which is very different from remembering upsetting things. We all remember upsetting times. We remember sad times. We remember good times. The quality of trauma is that your body in particular re-experiences those symptoms as though the trauma is happening again. And that's the thing that's really hard on people who are dealing with trauma, is that it isn't a remembering of the past. It's that as you start to remember the past, your body starts to go into those very real responses as though the trauma is happening right now again, even though it's not. So it's the past in the present.
How do you know if you should seek help? Is it obvious?
Not always. Not always. Sometimes people don't really realize what's going on for them because they're just dealing with their stuff. And if, there's a certain amount of, if you have a tough experience anytime, everyone knows there's a period of time where you kind of come down from that, like, a bad breakup, and we have a big argument with your spouse or something, like nobody expects everything to be fine 30 seconds after the argument's over. Sometimes it could be a day or two. So I think everybody kind of understands that when things are really hard, sometimes it takes a bit of time. What we usually say is, like, if you've had an exposure to a traumatic event, it can take up to 30 days under normal circumstances before you stop what we call sort of re-experiencing those things. So if after 30 days, and 30 days is sort of the line in the DSM that they draw between post-traumatic stress disorder and acute stress disorder, which are two separate things. But, the body takes a long time to get through these things. So if after 30 days, you're still experiencing really serious effects and really feeling the effects of that exposure, like you're remembering it, you saw the car crash and you can't get the images out of and you're not sleeping well and you're starting to get agitated and your mood's starting to change. If that's still going on or getting worse over the period of 30 days, and those are the things I start to get a little bit concerned. This might not go away on its own, but if it's a really bad trauma, it's not going to go away in a day. It might not even go away in a couple of weeks, but it should start to taper off. It should start to sort of come down where you're not as upset by it. You're not remembering it as much. You're not having as many dreams about it or thinking about it during the day when you don't want to. So obviously, if you're ever concerned about your own mental health, just go talk to someone. I mean, if you're suffering, you're suffering. You don't have to have anybody's permission to seek help when you're suffering. If you're upset and you're suffering, go talk to someone. I wouldn't wait. But if you're not the kind of person, because it's hard to go talk to a therapist. It's not always easy to go say, hey, I'm feeling kind of messed up and can I have some help? But part of why I wanted to do this podcast is to kind of get rid of some of the myths around this stuff, that it's normal when you get exposed to something really intense and you have one of those sort of lizard brain responses. It's normal to have some effects coming out of that. And as long as they are allowed to kind of finish and kind of come out the other end, oftentimes there's not a lot of negative effects to it. But what happens is that people get frightened by what their body naturally has to do to kind of come down from that. To give an example, we use this when we teach a lot, is if you've ever been in a near car crash, oftentimes people will say, yeah, I almost got hit by a car. Well, people say, well, nothing happened, but then their hands will start to shake, or they'll start to feel like they're feeling a little bit like emotionally, they might start to cry, and they think, well, what's wrong with me? Like, there was no crash. That's what happens when your limbic brain kicks in, is that it makes your body kind of do things. So your hands shaking, the adrenaline, that kind of stuff, that's completely natural when your brain assesses that something like you might have almost died happens. It doesn't matter that the accident didn't happen. As long as your limbic brain assesses that threat was there, it will give you some sort of physiological things to have to kind of deal with afterwards, because it mobilizes those systems, if that makes sense.
Can seeking help re-traumatize people, or is there that fear with people that seeking help might kind of trigger something? And
for sure,
yeah.
When you're dealing with people who aren't well trained, and you're dealing with, like, every profession has people who aren't the best at their profession, and then every profession has people who are not helpful. So is it possible to be injured by getting surgery? Sure, if you don't have a qualified surgeon, and if you don't do their job, and if they're not paying attention, and if they're, drinking that day, whatever, of course, there's always a risk when you go. But I think the bigger fear is that it's going to mess me up if I go. So I'm not going to go, and I'll just kind of knuckle down. Most of the people I work with have been trying that for years. And they've reached this point where everything they've tried isn't working, and it's only getting worse. So one of the big things that we say is, like, trauma is a relatively new field. At the university, we try to teach trauma as a foundational theory, but there's not a lot of programs that teach trauma practice as the foundational theory. It's often like an elective or those kinds of things. So I think we as a profession have a little bit more work to do. So you want to try and find somebody who's had some proper trauma training and actually knows and is comfortable talking with trauma. The simple truth is, if you've been coping with trauma, oftentimes when you get into working on it, like you go to see someone, you're going to probably start to feel worse before you start to feel better. But it's almost like if you injure say you injure your knee and you have to have your ACL replaced, going for physiotherapy is going to hurt. And sure, if you go to an unqualified physiotherapist, they might mess it up after surgery, but you're going to go to a really qualified physiotherapist, it is going to hurt like the blazes to do the proper therapy on that knee to get it back in shape. I think trauma in some ways is very similar. It's going to hurt. However, if you know it's hurting in the right direction, I talk about like productive suffering. I don't like to suffer, but I really don't like to suffer unproductively. And what I mean by that is suffering in a direction that's not helping. So most of trauma therapy is going to feel worse before it gets better, but it will be actually in a direction of getting you to where you want to go. So it's hard work. There's no therapist that can do therapy to you. They can work with you, but most of the work is going to be yours to do, and it's going to be hard work. But if you get the right person and they're on your team to do it, when you do it together with them as a team, you can actually make a lot of progress, even if it's hurting.
Stigma. And we always hear that people say there's no stigma, and you also maybe hear the phrase, the walk of shame. Mm-hmm. When it comes to stigma, the word stigma for me, I know people say that, yeah, there's no stigma, but I kind of feel like, maybe even stigma is not the right word, but mm-hmm. It makes people feel uncomfortable. People are not comfortable talking about mental health just as like an everyday conversation. What do you think about something like that?
I think we've come a long way. I've been doing this for about 20 some odd years now. We've gotten to the point, I not totally jokingly say, it used to be that if you had, if you were traumatized, you were just a coward. You were no good. You were whatever, add whatever pejorative term you want. I think we've come in the last 2 decades to the point of like, I won't judge you for being weak is kind of the main message I hear. If you can't handle it, it's okay. I won't judge you, which I think is better than I will judge you. I don't think we're far enough along the continuum. I think it's because still so much of it is that notion of not understanding how people get traumatized. People who are dealing with trauma have basically processes, physiological processes that are not finished. Most of what I do as a trauma therapist and my colleagues across the country do, we're trying to help people finish a natural process when you're exposed and your limbic system engages. If that finishes properly, usually there's not a lot of negative effect to what's gone on. Sometimes there is. Most of what we're doing in trauma therapy is trying to finish something that got started years ago that hasn't finished, but the body and the brain still tries to finish it. That's its job. So we try to say, like, I won't use the term we say, but we say not messed up, just not finished. That's what trauma work is. You're just not finished that. So what I'd like to see us move to is an understanding of how people get traumatized, and that the work of getting better out of trauma is finishing a natural process. Just like with physiotherapy, like if someone tears their ACL and you put them back on operational duty before they've done their physio and before they've got their quad strong and before they've done all their IT bent, if you do that, you can expect that they're not going to perform well. It's the same thing with trauma. If you bring people back before they've had a chance to finish and do that therapeutic part of getting their system back to where it needs to be, you can expect that they're not going to perform as well. The truth of the matter is that if you get traumatized and you live with that for a long time because of all the stuff that's going through your body, it does affect you. And so it's a sort of a steeper hill to climb the longer you go. So I've had trauma in my own life, but if I get traumatized, I'm just going to go to a therapist as quickly as possible because I don't want to have to climb out of a darker hole later. I'm just going to go. So I kind of encourage people, it's going to hurt. It's going to be hard work, but if you're not shy about doing the hard work, do it sooner rather than later. You'll get out of it. So I do think there's been some good change. I think there's a lot more understanding of PTSD, especially about traumatization. I don't think we're quite there yet, which is, again, part of the reason I agreed to do this, is really trying to help people understand when someone's traumatized, they're just not finished a process and their brain is trying to finish it. And that's why, and it's exhausting. When your brain continually tries to finish off this process, it's exhausting because it never stops. It never takes a break. So if we can help people finish what they need to finish and support them to do that, then they can come out the other side. I'm trying to help people say, like, if you're in a trauma-exposed profession like the military, I work with other trauma-exposed professions as well. I'd like to see people move it to a more sort of a higher professional standard, that knowing that when you're exposed to trauma and knowing when your limbic system engages, there's a sort of processing phase, that you take that as your next step. That if you're going to be a professional, if you're an emergency room physician or you're a fire or police or a paramedic, you learn this about your body, and that you are expected to do sort of a finishing process if your limbic system gets engaged. And that if you don't do it, that might be not the right mark of a professional. So kind of aspiring to, like, if you're a professional and you're exposed to trauma, this is just part of maintaining your system, just like maintaining your physical fitness, or just like maintaining your weapon or your vehicle or whatever. Your body's a system that needs maintenance, and true professionals will actually maintain it all the time and not let it sort of fall or deal with stuff. Like, it's like a car, right? I'm not very good with my car. It's like, you need to change oil. Everyone knows if you want your engine to run really well, you need to change oil every 6 months or whatever. Our systems in some ways are very similar to that. If you don't maintain it, you can expect it to break down. And so if you maintain it, it'll work for you much better, even when you're being exposed to those things.
You use the analogy of tearing your ACL. I've torn my ACL before.
Oh, so you're sitting there going, oh God.
Yeah. Do you think that trauma and people healing from trauma, that it can be as like an easier process as, tearing your ACL, going for surgery, or going to a physiotherapist? Could it be that comfortable of like having people being able to step into that conversation and not kind of shy away from it?
That's my hope. I mean, I think absolutely you can get to that point. Again, like for me, I know how people get traumatized, at least, in terms of what we see in terms of the work we're doing. It's a pretty clear response. So we teach this thing called the trauma formula, which is, again, just based on looking at sort of the cascade of events. You have a traumatic event, which you talked about. You have a limbic response, and then that limbic response doesn't finish. So whatever you need, like your hands are shaking, if you thwart that response, that tends to look like it leads towards trauma. And then if you add on to that a negative social response from around you, if you put all those things together, you're really increasing the chances that someone's going to end up traumatized. You've got people exposed to war zones. They have to, because they're on 6 months tours, go from one fight to another fight to another fight. They're taking on and having lots of traumatic sort of responses, but not being able to finish them. And then they come home and nobody understands why Canada was in Afghanistan anyways. And people ask questions or they don't even care. They don't even know what you're doing. No one's at the airport to greet you, whatever, in a military context. That seems to be, when in terms of the people I've worked with over the last 20 years, all the people I've worked with tend to have those experiences. They have the event. They haven't finished their limbic response. They've also had multiple negative social responses. If we can change the negative social response, we'll go, oh, well, so you haven't finished. Okay, well, so you're going for trauma therapy. It's like, oh, you're on crutches. So clearly have you started physio, right? Oh, no, not yet. I got to wait for the thing to heal. Oh, okay, well, and you go, well, where are you going? Oh, I'm going to a physio appointment. To me, it's no different in terms of the work that has to be done. And that social response is part of what, if people really understood how someone got traumatized and they were just like, oh, okay, great. So, well, let me know when you're finished. It's going to be hard. I know it's hard. Was it a rough day? Like, the difference being when you tear your ACL, you might sweat and you might have some sort of localized pain. And, obviously you can start to get feeling down because your leg doesn't do the same things it used to do. And you have to be a little bit more careful or change your things. In some ways, trauma therapy is the same way, that once you've experienced trauma that way, there may be things that you have to shift in terms of how you go about your day if you want to continue on that process of healing. I firmly believe that if people know how people get traumatized, the stigma just disappears, because it's just a matter of finishing a natural process that started, could be 5, 10, 15 years ago. And this thing that people don't like, I think the ACL is a good one. You can tear your ACL and ignore it. It doesn't heal the ACL. The ACL is not going to heal on its own. And when it comes to trauma, if you've experienced trauma and your limbic system's in that and you've ignored it or you haven't done anything to it, your brain will keep trying to heal, even if it doesn't necessarily heal itself all the time. That's when you want to go talk to somebody to help you with that process. But once you get the surgery, the surgeon doesn't heal you. All the surgeon does is put the parts back together. Now your body has to start healing, now that the thing's put back in place. And I see that's kind of what trauma therapists do. No trauma therapist can heal you. And that you don't need them to, because your brain, truthfully, most of what people experience in PTSD is the brain trying to do its job. And it just can't get finished. It just can't finish the process. If we can get you into a position where you can start to finish the process, sure, it's going to hurt. But as you finish it, you'll start to get that relief. You'll start to see, and things will start to get put. Again, if trauma is the past and the present, what we're trying to do is put trauma where it belongs, which is in the past. That's mostly what therapy is you take this thing that feels like it's there every day, all day, when you sleep, when you wake up, and put it where it belongs, which is in the file of, a terrible thing that happened to me one time. That's kind of the goal.
Resilience is a common word in the military community. Why is resilience important, or the resilient approach important?
Yeah, I have a particular way of thinking about resilience, because a lot of times people think about resilience being in a person. Is that person resilient? And I think with trauma, it's very much, it's more of a social responsibility for us to help foster resilience. So I think about organizations as resilient or not, rather than people, because no person can be resilient in the face of an organization that's big. Like, organizations are resilient. And they're resilient, in my mind, when the people know, they have good information about what trauma is and what trauma isn't. They understand what the brain does in response to being exposed to trauma. So, like, understanding that it's just your limbic brain response. Just like when the car goes by and you almost get hit in a crash and your hands start shaking. Well, that's just a thing. Your hands start shaking because the adrenaline starts coursing through your blood. It's just a thing. If people understand that, and then if people and organizations know how to respond when someone's in that space, then you're talking about resilience at an organizational level. Individuals can be resilient if they understand, like, oh, I just went through that thing. Like, after this conversation, if your listeners, if they, hopefully they never get in an accident. If they get in it, if there's a near accident, they will sit in their car potentially on the side of the road shaking, going, there it is. That's what they were talking about on that podcast. Like, my hands are shaking. It's like, that's fascinating. And so to me, that's how you start to develop resilience, is that you understand what your body's doing. You're not freaked out by it, but you notice, well, there it is. Does it feel great? No, it feels awful. But you understand that's how your body responds. And so you don't judge it. It's just a thing. I don't know if that answers your question sort of, in as clear a way as maybe you might hope to, but Resiliency put inside of a person, I find problematic because trauma doesn't sit just in a person. Trauma is a social phenomenon. To the extent that society understands, people around you understand, your family understands, that goes like a long way. And if everybody understands what's happening and everybody knows how to respond to that, to me, that's true resilience, not just making somebody stronger to be able to take more terror. Oftentimes the question is, well, how can we get it so that people can be exposed to more trauma and have no negative impacts? Like, well, the more trauma you get exposed to, the higher risk you are of having negative impacts. So why don't we talk about, if that person's responding, how do we respond to them after that? That's why, for me, it's an organizational thing, a family thing, a community thing. When we get there, to me, that's how you build resiliency. You don't build it in a person, but the person can certainly learn things, hopefully, from listening and reading and those kinds of things. But it can't be sitting with the person only.
Well, I think that's actually really an interesting response, because it's something I probably wouldn't have guessed. It really gets me thinking, just based on my own job and my own experience when it comes to resilience. So it does work for me. What are some things that families can do in this process? So you got someone who's obviously experienced the trauma, but a family member, what can they do?
Someone who has been traumatized, so say all those things went into it, they've been exposed, they've had these limbic responses that haven't finished, and they're really struggling. Like the people with trauma really struggle. It's genuine. When they're living with other people, that struggle then comes out in relationships. We know this. We know that it's hard to live with that. If everybody understands that what you're really dealing with is just that limbic system, right? And we run a couples program with the funding from Wounded Warriors called the COPE program, Couples Overcoming PTSD Every Day. The family plays a huge role, not just in supporting the member, but what we usually say is, if there's PTSD in the home, then the family has it. So again, don't put it in the person. Most of the members I deal with feel like, well, it's my responsibility. I don't want my family to have to deal with this. I'll just deal with it. I'll suck it up and I'll deal with it. And the truth is that there are things that you can do as a person. But if the family, what we try to say is, like, if PTSD is in the home, if everybody's on board and everybody understands what's going on, you have a much better chance of actually tackling it. So even though the person who may have been diagnosed with PTSD feels responsible, once it's in the home, everybody has a role and can be potentially really helpful in dealing with that. And again, it's about learning. Like, resilient families, they understand. We oftentimes talk about, well, how do you talk to kids about this? Because there's a lot of shame. People feel like, I feel ashamed that I have PTSD. And it's like, well, kids are amazing because they're just open to learning things. Say, well, if everyone knows that we all have lizard brains, and if the lizard brain gets affected in a certain way, it makes us do things. It makes us jump. It makes us irritable. It makes us angry sometimes. Kids get that stuff. Kids will understand that, because sometimes they do things just out of sheer anger and they don't know why. We all have that. Then putting in place those things for, if I am experiencing that and my lizard brain's taking over, how do we as a family help to make sure that the lizard brain doesn't take over and make things worse for all of us? If everybody's working together, particularly the couples working together, if they understand that of each other and they do it as a team, what we've found is that if the person's going to see a therapist on their own and their partner at home is doing it, and also understanding that it's not easy for them, so they need care as well, but that if they're both tackling it together, then they learn from each other what that person needs in the moment. And there's some responsibilities. If you have it, if you're in, say you have a spouse and you have it, learning that together you're going to be able to tackle PTSD better than you just doing it on your own, if you get the right skills, if you get the right information. And so that's what we try to talk about. Like, families can be absolutely more resilient as long as everyone understands what's happening. And that's usually the thing that most people don't understand. People feel crazy. They feel like I'm the problem, or I'm a terrible, husband or mother or whatever. And the spouse is like, I don't know. I just want to help. I keep trying, but it's like, nothing seems to work. We see people like that come through our programs, and just once they realize what's happening, they go, oh, and they realize they're not the only ones. They realize it's not just them. It's the PTSD that's doing it. And so we try to encourage people to tackle it together, not on your own.
Is there anything else you would mention about trauma?
What I said before, so much of what we see is just really understandable responses that they just have to finish. The finishing is hard. The finishing can be gut-wrenching, but it's a natural process that's just been prevented. And the longer you prevent it, the longer road you have to kind of get through, because the more unfinished stuff, the more things you have to finish, is just to not, I would say people tend to beat themselves up about trauma. And it's like, if you understand that it's just your limbic brain, and these are things that happen to people, anybody can be traumatized if you know how it happens. If it's happened to you and you found, have you been exposed to a traumatic event? Yes. Did you ever finish those limbic responses? Most people kind of look at me like, what do you mean? It's like, well, that's how I know you haven't done it, because if you've done it, you know it because you felt it. And then have you had these negative social responses? Shielding yourself from negative judgment is very helpful. So, just being careful about who you share your struggles with. Share it with the people who you really trust. Try to share it with the people who understand, because the negative social responses just make it that much harder to climb out.
Well, thank you very much for your time.
Yeah, you're welcome.
To learn more about the work of Dr. Tim Black, such as the Trauma Resiliency Program and the COPE program, that's Couples Overcoming PTSD Every Day, visit woundedwarriors.ca.
Thank you for listening to this episode of The Military Lifestyle. To learn more about this episode and to check out our other resources like the deployment app, go to esquimalt.mfrc.com. A special thanks to Organized Sound Productions for bringing our idea to life. Please share this podcast with your military family or with someone living the lifestyle. Subscribe to The Military Lifestyle on your favorite podcast app. Your support is greatly appreciated. Thank you for listening.